Hi everyone, welcome back to the channel. In this video, we're going to take a closer look at the MRCP PACES exam format, what to expect on the day, and how the exam is structured from start to finish. Let's get started. Let's start with a quick overview. MRCP PACES is a clinical exam and the final part of the MRCP UK exams. The exam is completed in a single half-day session, typically lasting around 2 hours, and takes place in a hospital or clinical skills centre. The examiners assess candidates on the 7 core skills shown. Candidates rotate through 5 structured stations. Across the exam, you will assess or interact with 8 different patients. The format of the PACES exam was updated in 2023, and this is the PACES 23 carousel, which shows you how you'll rotate between the 5 stations during the exam. You won't necessarily start at station 1. For example, during my exam, I started at station 3. The starting point can vary depending on how the circuit is set up on the day. Let's walk through each one, starting with station 1 and working our way to station 5. Station 1 includes 2 10-minute encounters, one focused on communication skills and the other on respiratory examination. After completing the station, you'll get a 5-minute break, which is standard between each station. Station 2 is a 20-minute consultation station where you'll take a focused history, perform physical examination, communicate effectively, and form a management plan. Station 3 includes 2 10-minute clinical encounters, one in cardiovascular and one in neurological examination. Station 4 involves abdominal examination and another communication task, each lasting 10 minutes. Finally, Station 5 is another 20-minute consultation, similar to Station 2. It's important to remember there's a 5-minute break between every station. This break is useful for collecting your thoughts or taking notes, which you're allowed to bring into the next station. That can be especially helpful for the communication and consultation tasks. I'll cover the details of each station type in a separate video. The MRCP PACES exam tests 7 core clinical domains. First, physical examination. Here, you're assessed on your ability to conduct thorough and accurate physical examinations. Next is identification of physical signs, spotting important clues that guide diagnosis. For example, identification of ascites in a chronic liver disease patient or listening closely to hear a murmur in a cardiology station. Communication skills are essential, showing empathy and explaining clearly to patients. Differential diagnosis tests your clinical reasoning to list possible causes of illness. Clinical judgment evaluates your decision-making and management plans. Managing concerns looks at how you respond to patient worries and emotions. Each PACES station is structured to assess a defined set of clinical competencies. The distribution of these skills varies. Some stations prioritize examination and physical sign recognition, while others focus on communication, clinical reasoning, and decision-making. This table provides a clear overview of which domains are tested in each station. Of particular note are stations 2 and 5, which assess all 7 core domains. These stations are comprehensive and carry significant weight in the overall assessment. Therefore, dedicating time to mastering these stations is crucial for achieving a successful outcome in your PACES exam. All the tables used in this video were taken from the official MRCP UK website. I highly recommend visiting their site to familiarize yourself with the exam format, even before starting your preparation. This will help you tailor your study approach according to what's required in each station. Thank you for watching. I'll see you in the next video where I'll share tips on effective exam preparation. If you're finding my videos helpful, please consider subscribing to my channel.